Good afternoon, and thank you for joining us today. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,146 new cases of COVID-19. This brings our statewide total to 25,345 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Approximately 1,250 of our total cases are in healthcare workers, and 1,869 of our cases are in 232 long-term care living facilities such as nursing homes and personal care homes. Tragically, we now have 584 deaths among those who have tested positive for COVID-19. And to date, all of the patients that have passed away are adults. It's important to remember that there is a lag time in reporting of deaths over the weekend, and that is part of the reason for the increase in numbers today. As of noon today, hospitals are reporting approximately 2,306 patients are currently hospitalized due to COVID-19. This is approximately 10% of the total count, and this has remained consistent throughout the pandemic. 666 of those hospitalized have required the use of ventilators or breathing machines. Across our healthcare system, approximately 42% of hospital beds, 37% of ICU beds, and nearly 70% of our ventilators are still available. We have received many questions about the demographic data about those who have tested positive for COVID-19. This is very important data to help us make informed and data-driven public health decisions. Unfortunately, out of age, gender, and place of residence, this data has been very difficult for us to collect. The way our current reporting system works is that information about a patient, including date of birth, phone number, address of residence, race, and ethnicity, should accompany every COVID-19 test. This information is collected either manually from providers and laboratories or from our automated laboratory reporting process. But unfortunately, what we are finding is data like race and ethnicity of patients is actually missing from more than 60% of the reports that are submitted to our department. Now, we know that the provider's first priority is to provide care to the patients, but it's important to remember that this is required information that will help us gather a complete picture of the pandemic in Pennsylvania. So today, we used our Health Alert Network, or a HAN, to remind providers and laboratories that actually they are required to include this valuable information in the reports. As I pointed out yesterday, we're actually undergoing a process to update this reporting system, which is called PANEDS, before the pandemic struck Pennsylvania. A major data system upgrade like this is really not possible right now. So we're making the best use that we can of our existing manual entry reporting system. The accuracy of the information we collect and are able to report is dependent upon those healthcare providers and laboratories in the information that they input into the system. I would very much like to thank all of the healthcare providers and the lab personnel for their work that they are doing to take care of patients, but also for inputting this data now and helping us make the most informed public health decisions that we can by providing us with the best data possible. Now here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice, or use hand sanitizer if soap and water are not available. Cover any coughs and sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come in contact with others. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families and our communities that we will recover together. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer any questions.
Thank you, Secretary. From the Carlisle Sentinel, is the Department of Health sending out employees to investigate complaints, COVID-19 related or not, at long-term care facilities, or are those on hold?
So for the most part, inspections of long-term care living facilities are on hold, but we are investigating complaints virtually and would send in personnel if absolutely necessary.
And then as a follow-up, what options are there for long-term care facility workers who need immediate action on dangerous situations at their workplaces that aren't being handled by ownership of the facility?
Well, I think that the first thing to do would be to try to reach out to the facility and try to correct the situation. But if that's not possible, we do have an anonymous complaint line for our nursing homes, and workers or anyone could call that anonymous hotline.
Again, on nursing homes, from the Scranton Times-Tribune, one director of a nursing home hit hard by the disease told us that they're not completely following the guidance issued on March 18th in terms of communal gatherings. He said the reasons include that there are people who need assistance dining in a communal room, and some dementia patients are placed in a common room for part of the day. The director stressed that all the residents are kept 6 feet apart and that he had the approval of the Department of Health. Are these acceptable exceptions to that guideline that the department issued for the long-term care facilities?
Well, so the guidance that we issued is very important, and for the most part, we expect facilities to comply with that guidance, as well as the guidance of the Center for Medicare and Medicaid Services in Washington. I'm not familiar with this specific case and whether they received any special instructions for the Department of Health, so we'll have to check on that. But certainly, overall, we would expect facilities to comply with the guidance.
As a follow-up, Scranton Times would like to know how many nursing homes are now working with ECRI.
I don't have that information at my fingertips, but we can check that. But we're very pleased with our collaboration with ECRI to provide this infection control virtual guidance and advice to nursing homes, which are very challenged right now.
From 6ABC, Lehigh County has the third highest infection rate in nursing homes in the state. Being it's mainly rural, why do you think this is the case, and why do you expect cases to rise in these types of nursing care facilities?
Mm-hmm. Well, Lehigh Valley has had a significant community spread with COVID-19. So it would not surprise me that nursing homes in Lehigh Valley are challenged. Whenever we're seeing community spread, then we expect to see these type of challenges in long-term care living facilities. Of course, people have to go back and forth, so they don't have visitors that coming in, but staff go in and out in terms of taking care of patients, but also cleaning the facility and food care workers, et cetera. And that type of community spread could be introduced in a long-term care living facility, and then it could spread there. Of course, you have very vulnerable patients who are seniors and those with other chronic medical conditions, and they're in their rooms there following the guidance. And so it's a very vulnerable population, both in nursing homes and in personal care homes, and we're taking every precaution that we possibly can to protect them.
From Lehigh Valley Live and the Philadelphia Inquirer, some questions about data. More specifically, within nursing homes, how many residents have died, how many staff has been affected?
I don't have that specific data at my fingertips, but we can get that. I have given the general data about how many patients are positive and in how many facilities, but we can work on getting that other data out.
And then does the department plan to release additional data on the confirmed cases, including more specific geographic and demographic information?
Yes, we're working on that type of release over this week.
From the Philadelphia Inquirer, New Jersey Governor Phil Murphy signed an executive order requiring grocery stores to limit customers and keep store capacity to at least 50%. Mm-hmm. He also required customers and employees to wear masks in the supermarkets. Do you plan to issue any such orders in Pennsylvania? Why or why not?
So we are having active discussions within the Department of Health and with the Governor's Office on that type of guidance, so stay tuned.
And then also from the Philadelphia Inquirer, the state recommended people without cars contact their doctors to figure out how to safely get transportation to testing sites. The Inquirer is reporting that many people haven't been able to get those answers from their doctors, and some healthcare systems have deferred questions about transportation to the department. Given that there are Pennsylvanians who can't get tested because they don't have transportation, do you plan to issue any recommendations for people without cars?
I think that's a real challenge. Of course, we don't want lots of people who might have COVID-19 taking public transportation, and we're trying to really expand the testing as much as possible, particularly in urban areas where it might be possible if there's enough testing sites for people to either walk there or get other transportation. But I think it is a real challenge. We speak on a regular basis with the Commissioner of Health in Philly and the Commissioner of Health in Allegheny County, and so we'll have those discussions. And then, of course, it's a completely different issue in rural counties, so we'll have to brainstorm on what the best solutions might be.
From WNEP, when will dentists' offices be able to resume normal operations? And when they do, will the state provide them with personal protection equipment? Mm-hmm.
So dental offices can be open now with specific guidance that we release for emergency procedures. So individuals might have emergency dental needs and have to see a dentist or an oral surgeon, and that guidance is out. In terms of more preventative care, that will really depend upon when we start to open up businesses in Pennsylvania. And we're having those discussions as we speak about what would be the right timing for that. And so that would include dental offices for preventive care. Personal protective equipment such as surgical masks and gowns are important for dentists. We're not planning to use and send the N95 masks unless they're seeing patients who are diagnosed with COVID-19. Those N95 masks have to be for healthcare workers on the front lines treating patients with this deadly virus.
From WNEP and WBRE, some questions about a testing site in East Stroudsburg. Equipment from a medical facility set up at a school outside of Philadelphia is being sent to East Stroudsburg. When can we expect that facility in the Poconos to be up and running, and what services are going to be provided there? Mm-hmm.
So we're working with the Pennsylvania Emergency Management Agency and Director Padfield on when that site will be open. We're hoping that will be maybe later this week or certainly by next week. And as with the other mass testing sites, we're going to be prioritizing healthcare workers, and that could include hospital workers or those in other health systems or in long-term care living facilities, EMS workers as well, and then those that are sick and have symptoms, especially seniors. We do not plan to be able to do testing of asymptomatic people at this time. We simply do not have the laboratory capability in terms of reagents and test kits to be able to do that population surveillance testing at this time.
So as a follow-up, which was actually WBRE's follow-up question, was about the drive-through testing in Luzerne. In terms of the East Stroudsburg location as an alternative care facility, could you talk a little bit about that?
So we do plan in East Stroudsburg to build up an alternative care facility. So this is to take care of patients with COVID-19 that are getting better. They're improving, but they're not quite ready to go home yet. And so we'd be able to decompress the hospitals with those patients. I don't have a specific timeline that, when that would be open. A lot of it will depend upon how stressed our hospitals are with patients with COVID-19, but we're getting that test site ready, care site ready, as well as the site in Philadelphia.
From WPXI, do you see the need for antibody testing to be in place before sections of the economy can reopen?
No, I think that it would be very helpful to have antibody testing be available, but it's not available at this time. There is one test that has FDA approval, but it's not ready or available to get. There are some other tests that are being evaluated by the FDA, and when the right test is available, we will be getting that test for our laboratory in Exton, and then we'll work with hospitals and health systems to get the tests or a different type of serology testing, and then commercial laboratories. But the timetable of that is uncertain, and we don't want to wait in terms of when we might start to release the stay-at-home order or start to open businesses. So and it'd be great if all those tests were available at that time, but I'm not sure they will be.
From ABC 27, legislative Republicans are suggesting the terms essential and a non-essential for business are incorrect, that the proper term should be safe and unsafe. They insist that some essential businesses that are open but operating there are essential businesses open but operating unsafely, while there's some shuttered businesses that could be operating safely. What's your reaction to the differentiation?
I think the governor, and working with the cabinet and the Department of Community and Economic Development, has done a fantastic job in terms of defining essential and life-sustaining businesses. And the examples we often use are in the food industry and grocery stores, as well as pharmacies, et cetera. And then those that are not essential and life-sustaining, which have been closed. So I think that is the correct designation. I mean, I think that the mitigation efforts, the prevention efforts that the governor has put in place have been working. We have been able to flatten the curve in terms of the number of new cases that we are seeing. If you remember, last week we had over 1,900 new cases in a day, and today we have 1,100 new cases in a day. And it's still too many. We don't want that many new cases, but the curve has been flattened significantly. We have over 25,000 cases, but if you look at some of the old FEMA predictions, if this was going up exponentially, like we had talked about, then we would have expected over 60,000 cases. So we are doing a fantastic job. We have to continue those efforts until the time is right, in a slow, progressive fashion to start to open businesses and cancel the stay-at-home orders in a regional, maybe county-wide basis, in a slow, iterative fashion. And when the time is right, the governor will make that decision.
From the Associated Press, is there any way that you can enforce the requirement for labs and health providers to submit demographic data on COVID-19 patients?
Very hard for us to enforce it, so we're going to rely upon all of our healthcare personnel and laboratories to do the right thing and to fill out that information for us so we can have the right demographic data to make the right decisions.
From Penn Capital Star, you've mentioned that Pennsylvania will need to move to population-based surveillance tracking to relax social distancing orders. How many tests do you estimate would be necessary each day to perform this kind of tracking?
So I would love to have that type of population-based widespread testing available, but at the moment it is just really difficult to access the chemicals and reagents necessary for the different testing platforms. So we're not sure that widespread population-based testing will be available at that time. We are hopeful, however, that we will have that as time progresses and into the summer and later in the summer, and we'll be able to do that type of viral testing as well as that serology antibody testing, but we'll have to wait till the testing kits and reagents are available.
From WESA, Governor Wolf said yesterday, we don't have a hard and fast metric for exactly when we will achieve victory, but we need to develop one, and we soon will. Can you provide any additional specificity to this? What kind of factors are being taken into account?
So we are looking at many different factors for when we would start to open up areas of the state and when things will be able to be opened up throughout the state, and we'll be able to do more of that surveillance testing. It'll be when the number of new cases is going down on a consistent basis, perhaps with very few new cases, only in certain areas, and we're not seeing these flare-ups and outbreaks. But we don't have to wait for that to happen to start to open up different parts of the state, and that will happen when the time is right according to the governor's decisions.
From CNHI, recognizing that the state has begun sharing information about the location of coronavirus cases within counties, the federal government on March 27th added coronavirus to the list of conditions for which first responders must be notified if they've been exposed. Can you say whether or not the state was telling first responders if they were exposed to coronavirus even before the federal government required it?
We certainly agree that first responders should be told. I believe we were working with the hospitals to inform first responders if a patient that they had transported, for example, had been positive even before that was required. That's my understanding, but I am not exactly sure of the timeline.
From the Reading Eagle, what should workers do in the event they feel employers are not creating a safe workplace by following the state guidelines for social distancing? Can they come forward to report an unsafe condition?
Yes. So, I mean, hopefully they can work with their employer to provide safe conditions in terms of social distancing. If they feel that they can't, then they can contact the state.
Previously, you had mentioned, this is from News Talk 104.1, previously you had mentioned mitigation efforts may take 2 months. Is that still the situation now?
I think it's going to depend upon the cases that we're seeing on the ground. Again, we have been able to flatten the curve. We need to make sure that that continues, and then we'd actually like to see the curve bend. But I don't think that it'll necessarily be 2 months before different parts of the state might be able to have businesses open and then have a relaxation of the stay-at-home order. We'll just have to take that day by day and week by week, depending upon the conditions that we're seeing, models that we have, and then the governor will make a decision about it. But again, it's not going to be one grand opening of the state. It's going to have to go in a slow, progressive fashion, region by region, county by county, maybe even municipality by municipality, watching for outbreaks all the time.
And then as a follow-up, if the PA House and Senate provide Governor Wolf with legislation to reopen aspects of the economy, what advice would you give the governor into reopening?
Well, the governor and I are exactly on the same page in terms of the mitigation and in terms of how things might reopen. And so the governor will address that legislation if and when it's passed.
So from WNEP, a viewer asks, we are told to wear masks, wash hands, etc. when we go to the grocery store. What about our clothing? How long can the virus live on clothing, and should we change clothes, launder them, and take a shower after shopping?
So there is no specific advice about that. We know that COVID-19 can live on surfaces. I'm not sure if it's exactly known how long it might stay on clothing. So that's not an official recommendation, but it's not unreasonable.
From WKOK, where in Pennsylvania are hospitals overwhelmed? In rural Pennsylvania, they're keeping up easily, but is that true in Philadelphia and Pittsburgh?
I don't think that they're overwhelmed anywhere. There are certainly more cases in southeastern Pennsylvania, in Philadelphia, in the suburban collar counties, and there are more cases in northeast Pennsylvania. And the hospitals there certainly have significantly more patients and are challenged, but there are no hospitals that are overwhelmed. We are working to provide personal protective equipment, such as those N95 masks and gowns, et cetera, when necessary. And we recently had a large push out of those type of personal protective equipment over the last day. In addition, we're watching in terms of the utilization of intensive care unit beds and ventilators, and so far we're doing well. For instance, Philadelphia has not had to use their federal medical site to date. But we're watching that really carefully and the numbers to make sure that no hospital or health system becomes overwhelmed.
From Erie News Now, We've heard Rite Aid will begin expanding COVID testing from Philadelphia to Harrisburg and then perhaps over to Erie. Do you know about this plan, and can you offer any comment to it?
We would support any expansion of testing for COVID-19, and so that would be a very positive development.
And then as a follow-up, WKOK is also asking, have we successfully flattened the curve? When can we get back to normal, and what would the new normal look like?
Well, so we are flattening the curve. We have had a significant decrease in terms of the number of new cases that we are seeing per day, and in terms of the total number of cases compared to that previous exponential rise that we are seeing. And so as we are continuing to watch that really, really carefully, continuing to watch for a potential surge of new patients, then the governor will make decisions about about each region, each county, and perhaps even more granular than that about when businesses can open and when the stay-at-home order can be relaxed. So it's going to be in a very stepwise, progressive, careful fashion.
From the Tribune Review in Pittsburgh, Allegheny County has continued to see a relatively low number of cases compared to other areas with the same population. Has the department been watching these numbers, and what do you make of them?
So we have been watching these numbers very, very carefully. And as I mentioned before, we have a daily phone call with Dr. Bogan, who's the health commissioner of Allegheny County. I think they're doing a fantastic job in Allegheny County in terms of their mitigation and in terms of their testing. And we hope that that trend continues and that they are able to not see any type of outbreak or significant rise in cases.
From Fox 43, it seems like the number of tests given every day has been decreasing. On April 7th, you reported more than 7,400 test results, both positive and negative. Today's numbers show about 3,839 test results. Why do you think that is? Are less people looking to get tested, or tests not available?
Well, I think that we are seeing a decrease because the mass testing sites in Philadelphia and Montgomery County closed. They were producing a significant amount of tests. And then the one in Philadelphia is being compensated for, and we are going to reopen the one in Montgomery County. And as I mentioned before, we're going to open a testing site in the Northeast as well. And we're going to continue to encourage more people to get tested, and we need to make sure that we have the reagents and chemicals necessary for that testing.
As a follow-up, you mentioned flattening the curve, but when you compare the number of new tests each day compared to the number of new cases, the percentage has stayed pretty much the same and maybe gone up a little bit. Would this still be flattening the curve, and do those percentages hold weight?
So it is still flattening the curve because, as you said, we're not seeing a smaller percentage of tests that are positive compared to the number of tests we're doing. So I really am very confident that we are flattening the curve, but we certainly want to see more widespread testing in Pennsylvania.
WGAL would like to know if we believe that April 9th was the peak, since we've been seeing a downward trend since then.
We'll only know that in retrospect. If you look at the University of Washington models that they just updated yesterday, they're saying that the surge is later this week in terms of our needs for the healthcare industry, as well as in terms of deaths. We'll see of how all those models play out. Again, we follow many different models. The University of Pittsburgh model, a model from Penn, the model from the University of Washington. We see models from FEMA and the federal government, and we put all that together in terms of our estimates. But we're very pleased with the flattening of the curve that we have seen, which has saved lives.
As a follow-up to your earlier remarks about nursing homes from the Carlisle Sentinel, they're asking, how does a virtual investigation of a complaint work?
Well, so our team would be calling the nurses at the nursing home and discussing their testing, discussing the positive cases that they have seen, and then doing and getting into a lot of detail and doing a deep dive in terms of exactly where those patients were, what staff might have been exposed to those patients, what type of personal protective equipment were being worn, and then they'll kind of map out a strategy for infection control that that could include moving staff, could include cohorting staff and patients, and many different factors. They want to make sure that all the staff are trained to use personal protective equipment if necessary, and they can even do virtual tours with the staff of the facility to get really granular in terms of what the needs will be. And so we're very proud of our staff as well as the ECRI staff and the consultations they have done with long-term care living facilities. We'll do everything we possibly can to protect this very vulnerable population.
Our last question is from WPXI. The Smithfield food plant in Arnold has 6 employees that have tested positive for COVID. What's your guidance regarding food safety since these workers handle food? Is there any potential danger to the public, and should the plant potentially close?
Well, we do not feel that there's any potential danger to the public, but it is very challenging in the food preparation industry. And there was a plant that closed actually, I believe, in North or South Carolina, Dakota. And so we want to make sure that people have food. It's absolutely an essential to life, and it's certainly an essential industry. So we're working really carefully and closely with Secretary Redding of the Department of Agriculture, who has reached out to the food processing plants to try to add best epidemiological practices and try to protect those workers and those necessary industries.
Thank you, Secretary. That concludes our briefing for today. Our next briefing will be tomorrow.